There are now approximately 170 HHS shelter programs for migrant kids across the country, from small foster care sites to places like Homestead. HHS houses the youngest migrants, infants and toddlers, in a handful of facilities they call tender age shelters. We were recently given rare access to this shelter, holding babies and teenage mothers in San Benito, Texas.
This is our busy hallway. There's constantly children playing, nursing, eating.
Melissa Aguilar is the director of shelter programs for Comprehensive Health Services, a private company that runs the shelter.
We focus on 0 to 17, so we have mothers in care, we have the capacity to service pregnant teenagers, and they can also care for their babies here. A staff said it earlier today, and she said it best, that the children are borrowed. They're borrowed for our purpose, right? So a lot of times when something is borrowed, you take care of them better than you would something that is your own.
The company runs 5 other shelters, including Homestead, and among its leadership is former White House Chief of Staff Jon Kelly, who'd backed the policy of separating kids from their families at the border. Over the past year, the government has paid CHS nearly $300 million. By its very definition, when you're for-profit, your job as a company is to make a profit. So some people might say then, isn't there then an incentive to detain kids?
There is a profit, there is a price incentive, but it's not a detention incentive. The question about is there incentive to detain children? Absolutely not. And I think that it's so important for everybody to understand that we're not detaining children, we're not separating children, we're caring for children.
Morally, ethically, is it okay for a for-profit company to make money from holding children in mass facilities that they cannot leave?
They're not the ones determining what kids are coming there. They don't really have as much say over who stays there. We can move kids in and out if we so desire. Am I personally opposed to, for a for-profit company? I've thought about that question, and honestly, I'm not. And at the end of the day, when you get down at the shelter level, you're basically talking about just a bunch of social worker, child welfare experts that just want to help care for the kids.
We know from the American Academy of Pediatrics that there's no amount of time that it's safe for children to be detained. We know definitively that detention harms children, that every single day that children are there, those impacts compound.
Recently, HHS's internal investigator looked into the issue.
They took a look at this shelter system and concluded in their own report that the mental health needs of these kids was not being met. Some kids were getting stressed out to the extreme, inflicting self-harm, becoming extremely withdrawn and depressed.
Beyond the mental health impacts, there have also been documented cases of physical and sexual abuse at some HHS shelters, and the AP reported that children and families are now suing the U.S. for hundreds of millions of dollars.